Hi, I'm Hannah. Is your name Aisha?
Yes, it is.
Okay, cool. I'm going to be taking your blood pressure today. So before we get started, I'm just going to walk you through a couple of forms that we're going to need you to fill out before the exercise testing begins. The first one is going to look like this. This is called an informed consent form. So I'll walk you through what it all says. The first part is going to be purpose and explanation of the test. So this is just going to explain the type of testing that you'll be doing, what kind of bike you'll be on, or what kind of cycle you'll be doing. And then the second part is attendant risk and discomforts. This is just saying that you might experience some symptoms or discomfort during the test, and if you do, like anything that's painful or too discomforting or is making you feel fatigued, just let us know and we'll stop the test immediately. Responsibilities of the patient, kind of the same thing, just making sure that you're aware that it's your responsibility to let us know if you have any discomfort or any pain, shortness of breath, if you feel dizziness, anything like that. And if at any time you want to stop the test because you don't feel good, just let us know. You're in charge when we're doing the testing, so if you ever want to stop, we'll stop the testing. Number 4, benefits to be expected. This is just going to go over any benefits that might come with the testing regarding your diagnosis or any illness that might come from your diagnosing. So this is just going to go over types of medications, physical activity levels that you need to be doing after the testing results. Inquiries, this is just going to say if you have any questions during the procedures or about anything, just let us know and we'll always try to answer them. Number 6, use of medical records. So when you do submit your medical records to us, just know that we aren't allowed to share that information with anybody to protect your privacy. The only thing that we will be using it for is for a statistical analysis, which we do get your consent on as well. And then the last part, freedom of consent, just saying that you're not being forced to do this, you're voluntarily partaking in these exercise testing. And again, you're in charge, so if you ever want to stop, we'll stop, just let us know.
Okay.
And then the bottom just says that you've read all this, you understand it, and then you'll sign here with a couple of witnesses and then your doctor. Do you have any questions about that form?
No, ma'am.
Okay, cool. So the next one is going to be a PAR-Q Plus form. That's going to look like this. This is pretty much just a questionnaire that you would fill out by yourself. It's just going to go over the types of physical activity level that pertains to you, because it differs from person to person depending on, symptoms, diagnosis, illnesses, things like that. Any questions about this one? Okay. So the other thing we're going to need you to fill out and we'll discuss is your medical history. So anything like previous surgeries you've had, recent hospitalizations, medications that you might be on, any signs or symptoms of discomfort or cardiovascular disease, renal diseases, things like that, as well as your family medical history. So what it looks like health-wise on your mother's and father's side, if they have any signs or symptoms as well. And then the next thing, kind of the last thing before we get started with the blood pressure, is the algorithm that we're going to use. So for you, since you don't partake in regular exercise every day, and you do not have any signs or symptoms of cardiovascular, metabolic, or renal diseases, we're not going to need medical clearance for you. So we're going to start you off on light to moderate exercises. So, any questions so far?
No.
Okay, perfect. So first, we're going to go over how I'm going to take your blood pressure, and I'll make sure that I walk you through everything as I'm doing it, so you're not confused or anything. First, is it okay if I touch your arm to take your blood pressure reading? Okay. So I'm just going to have you lay it like this, extended on the table. We want to make sure that it's at heart level. So the first thing I'm going to do is get your maximum inflation level. So the way I'm going to do this is I'm going to wrap this around your arm.
No, just up or down?
Up is good. Thank you. Just going to wrap this guy around. And I'm going to attach him. Oh, sorry. I'm going to attach him right here so it's easier to read. So basically how we get your maximum inflation level is I'm gonna feel your radial pulse, which is gonna be right here below your thumb, and I'm gonna inflate this dial until I can no longer feel this pulse down here. And once I get that number, I'm gonna add 20 onto that number, and that's gonna tell me how much I need to inflate it to get a proper reading of your blood pressure. Sound good?
Yep.
Cool. I'm gonna feel for this first. You're good. Okay. So that number was about 120 millimeters mercury, so I'm gonna add 20 onto that, which is 140, and we're gonna inflate it up to 140 when we do take your blood pressure. So just really quickly, just to go over some factors, and while we let your arm rest a little bit, some factors that can affect your blood pressure are things that you drink or eat. So you want to make sure you try not to eat or drink anything within 30 minutes of getting your blood pressure taken if you can help it. Things like smoking within that 30-minute period as well. Also, sometimes there might be faulty equipment, or if there's background noise, it can be hard for the technician to kind of hear what we need to hear with your systolic and diastolic numbers. So things like that, and you want to make sure you're not chewing gum or your feet are flat on the table, or flat on the floor, not the table, and things like that. And like I said before, you always want to make sure it's at that heart level. All right, we're going to get started with your blood pressure reading. So another couple of things about reading blood pressure is you want to make sure that this cuff is covering 80% of the arm, and I'm always going to put the cuff 1 inch above this little antecubital fossa area, and it'll line up with that brachial artery as well, where we're getting that blood pressure from. So I'm going to stick these in, and again I'm just going to inflate that number to 140, and I'm going to place this bow right in that area of the antecubital fossa. And I'm going to go ahead and begin inflating. Okay, so that number came out to be 135/85. So let me write that down. Which puts you in the classification for pre-hypertension.
And what's that mean?
That just means, you don't qualify for taking any medicine for hypertension yet. We do encourage lifestyle modifications, so maybe modify some things that you're eating, drinking, as well as your physical activity level, which the testing will also help us get some modifications going for you. So while we take that 1 minute break for your arm to rest a little bit, just so you're aware, when you are doing the exercise testing, blood pressure readings will look a little differently. The cuff will still go in the same place, cover 80% of the arm. The only thing that's going to be different is instead of inflating it to that number of 140 that we got earlier, we're going to inflate it to 200, which is right here. And then instead of releasing it kind of slowly, so when you're resting, like right now, I only inflate it 2 to 3 millimeters per mercury per second, whereas when you're exercising, I'll deflate it from about 5 to 6 millimeters per second. So it'll go a little quicker. Any questions about that?
No.
Okay, cool. All right, we're gonna get started with the second reading. I'm gonna do the same thing, just place this bell right in here and inflate to 140 again. That was about 130/85. Let me write that down for you, which is again in that same category of pre-hypertension. And when these are taken, you always want to go with the higher number, which in your case, it's still both of them pre-hypertension, but just for future reference. You're welcome.